back. Yep.
Good afternoon, everyone. Thank you for your continued coverage. I'm joined today by Dr. Joe Cantor of the Department of Health. He will speak in just a moment. And today we're also pleased to have Dr. Kimberly Mukherjee, who is on the Executive Committee of the Louisiana chapter of the American Academy of Pediatrics. She's also an assistant professor of clinical pediatrics at Tulane University and Children's Hospital, New Orleans, where she also works as a general pediatrician. Yesterday, I was able to visit the University of Louisiana at Lafayette to see firsthand their vaccination efforts and also testing efforts as students begin to return to campus. Was very pleased with the really good work that I saw going on there. Also visited similar efforts at LSU earlier this week. ULL and LSU are among 36 institutions of higher education participating in the Shot for 100 vaccine reward program that we announced 1 week ago today. We were very pleased that that actually was able to start on a handful of campuses this past Monday. And just to recap what that program is, the Shot for 100 will give a $100 Visa gift card to 75,000 college students when they get vaccinated at a participating institution of higher education. As I mentioned a moment ago, we now have 36 institutions that are participating in. They've opted in. And the report I got this morning was that about 1,518 cards were distributed through yesterday. And of course, many of these campuses are just now starting to get their students and to schedule these vaccine events. So I do want to thank all of the universities for their work and the technical colleges and so forth, but foremost the students who've decided to go sleeves up. It is the single most important thing that they can do to prepare for this semester and to also protect their family and their friends and their community. Shifting to our daily update, we continue to report astronomical numbers of cases across the state of Louisiana. Today, 5,922 new cases of COVID being reported. And very sadly, we're also reporting 67 new deaths across the state of Louisiana. We currently have 2,999 individuals hospitalized with COVID-19 around the state. This is the second day in a row that we haven't set a new record. And in fact, we've had very, very small decreases. We basically have been flat over the last couple of days. And of course, that's a glimmer of good news anyway, and we'll certainly take it after those 16 days of new records. At this point, as I mentioned, we'll take any good news where we can get it. But 2,999 people are way too many for a hospital system the size that we have in Louisiana. It's about a third higher than the previous peak of the worst surge that we had prior to the current surge. And it is stressing our healthcare delivery system in ways that we can only, begin to imagine. It is tough. I had an opportunity to visit with some medical officers in the Lafayette region yesterday when I was down there. And of course, we've detailed much of the impacts of the patient load that we're having across the state of Louisiana. And it not just as it relates to care for COVID patients, but anyone who needs life-saving care at a hospital in Louisiana is being impacted by this high level of hospitalizations that we've been seeing. 470 of the 2,999 are on mechanical ventilators. That's down 6 from yesterday. And I told you about the astronomical number of cases. One of the things that's very different about this current surge and the cases that we're seeing that are a result of the Delta variant, which, by the way, practically 100% of our cases today in Louisiana are of the Delta variant. The last time we measured it was over 96%, I believe. So that's what we're talking about. But the cases that we're seeing in children, 0 to 18, is very troubling. I can tell you that for the last couple of days, 28% of all the new cases that we're reporting, 28% are in children, 0 to 17. And with schools having started recently, and I think some more still coming online, I think we have 2 or 3 school districts that will open between now and Labor Day. It's all the more reason why we have to do what we can to protect kids. And we need to be very mindful of the fact that while 2.2 million Louisianans have received a shot, not a single Louisianan under 12 has received a vaccine. And it's up to us, especially adults, to do what we can to protect all of our children. And in addition to the total number of cases that we're reporting through the Louisiana Department of Health, during the week of August 9th through the 15th, a total of 2,444 COVID-19 cases were reported among K through 12 students and staff. Now, this is reporting that's coming from schools. And so more cases were reported by Louisiana schools during the first week of this school year than were reported in any week of last school year. And more cases were reported in the first week of this school year than were reported in the aggregate of the first 2 months of last year. And then the first week number that I just gave you, 2,444, that's with only 1/3 schools reporting. There is a very significant disease burden in this population. Transmission is very high, which is why the CDC has made the recommendation for masking in schools, universal, students, teachers, staff, visitors. That's why it was also the recommendation of the American Academy of Pediatrics. Simply put, we cannot keep our schools open or our kids safe today without masks. Through 2 weeks of reporting from schools, they have reported 5,328 kids and 750 staff with cases of COVID-19. And when you look at the close contacts, there are 23,000 close contacts who've had to leave school for some period of time because of that. Just the way math works, a close contact when you're masked is someone without a mask, I should say, twice as many people would be identified as close contacts. And those individuals would not be able to go to school. So we just all need to just understand how significant this situation is in Louisiana with the number of people who currently have COVID-19, the level of transmission that's happening, and how it's affecting our young people. And of course, the young people are infectious, if they have COVID, whether they're at school or not. And so they're bringing it home and into the community and so forth. And the fact of the matter is we think the vast majority of this is not happening at school because that's the most structured environment for the kids. They're actually contracting disease at home and in the community and so forth, and then bringing it to school. But nevertheless, they're infected and they're infectious. And if we're going to curb the overall amount of transmission and cases we're seeing in the state, our children are a big part of that, which is another reason why masking is very important in our schools. Dr. Mukherjee is going to speak more on what we're seeing with COVID in our children in just a moment. Before I turn it over to Dr. Cantor, I did want to talk a little bit about monoclonal antibodies because that's receiving a lot of attention here and around the country. There's been a lot of focus on it this week, and I think that's a good thing because people need to know what their treatment options are. This treatment helps to preserve hospital capacity because it is effective in preventing the disease from progressing to the point where someone needs to be hospitalized. It is not 100%, it is not a silver bullet, but the monoclonal antibody infusion, if received very shortly after someone tests positive and develops symptoms, it can prevent that disease from getting to the point where they need to be hospitalized. If you get it, the later you get it relative to symptom onset, the less likely it is going to be effective. And so it is a big part of our strategies to preserve hospital capacity by keeping people out of the hospital is to the maximum extent that we can. And that's why we believe in it. In fact, we have really, in a very robust way, promoted MAB infusions, monoclonal antibody infusions, since they first came out. And in fact, the Trump administration recognized Louisiana for the number of MAB infusions that were being administered in our state very early on relative to other states. So we're focused now on making sure as many providers as possible have this treatment available to them. Currently, across the state of Louisiana, there are 176 providers administering monoclonal antibodies. We've added 41 since July the 1st. And I'm going to give you a staggering number. The doses administered in Louisiana since that time, since July 1st, are up 27 times, 2,700%, with almost 7,000 infusions last week alone. And we continue to work to make it more available, and we want to make it more easily accessible to people out there once they test positive and have that symptom. But it is just one part of our strategy. We really try to keep people from getting COVID in the first instance, if at all possible. That is certainly the preferred thing. We need to make sure that people are being vaccinated. We need to make sure people are masking and distancing and doing all of those things. But if you test positive and you have symptoms, immediately call your doctor, if your doctor hasn't already discussed this with you, and ask about the monoclonal antibody infusion. And we will be doing more work to make sure that individuals can get connected to these infusions and these sites where they're being administered going forward. It is administered via infusion, and so it takes a fair number of healthcare workers in order to administer the monoclonal antibodies, and that is having an impact on the staffing at beds. And so we continue to try to bring in additional staffing, set up additional locations where this can happen, both so that we can increase the number of monoclonal antibody infusions that are being administered, but also so we can return staff to the bedside and augment the staffing capacity in our hospitals. So it's all of these efforts kind of work hand in hand together. I was able to visit yesterday with the chief medical officers of the Tier 1 hospitals in Lafayette. And of course, on Tuesday this week, as I always do, I was able to hear directly from Tier 1 hospitals from across the state. And I can tell you our healthcare professionals, they need a break. They are completely exhausted. And that's physical exhaustion, mental exhaustion, emotional exhaustion, and things are getting tougher, not easier as we speak. So the vaccines remain incredibly important, and I know there's a lot of talk this week about third doses and booster shots, And I'm going to ask Dr. Cantor to come up now and brief you on the latest as it relates to third doses and booster shots. He'll share some additional information with you. He'll then be followed by Dr. Mukherjee, and then I'll come up and wrap up quickly and take your questions. Dr. Cantor?
Good afternoon. Thank you, Governor. On behalf of Secretary Phillips and the Department of Health, we thank you again for your leadership throughout this pandemic. And a really special and sincere thanks to Dr. Mukherjee for coming to join us. I'll tell you, as a clinician, nothing harder that I've ever done than caring for sick patients. So to take time out of your clinical duty to come and share some stories about what families are going through and what challenges face the pediatric population, I think it's going to be meaningful. So thank you, Dr. Mukherjee. I'll give a little bit of data to paint in the top line stats that the governor said. If you can go to the next slide, please, and one more after that, please, too. This is the four quadrant slide we've been looking at every week now for a while. On the top right, on the top left, you'll see COVID-like illness. This is the percent of ER visits attributable to people seeking care for symptoms suggestive of COVID. We've gone down just a little bit to now 13.5%. So 13.5% of all ER visits in the state now is someone coming in with symptoms that could be COVID, chest pain, fever, shortness of breath, and so forth. On the top right, you'll see incidence, which is the number of new cases diagnosed day on day, smoothed out over a 7-day rolling average. We continue to be at historic highs for us. We are now averaging 109 new cases per 100,000 residents per day. And I make that emphasis because the CDC's highest risk category is for localities that have over 100 cases per 100,000 residents per week. And yet again, for now, I believe the third week straight, we've exceeded that mark for daily. Just a lot of COVID. It remains true. There's just a ton of COVID being spread across Louisiana right now. We have increased the amount of new COVID cases diagnosed by about 300% over the past month. On the bottom left, you'll see testing volume in the purple line, which remains quite high, and you'll see percent positivity in the orange bars below that. We did go down just a little bit this week in statewide percent positivity. Last week, we were at 16.1% of all tests being conducted coming back positive. We're now down to 15.5%. Really, anything above 5% is of concern, and we've been above 5% for some time now. And on the bottom right, you'll see the number of patients hospitalized with COVID in inpatient beds throughout the state. As the governor said, we're now at 2,999. This is thankfully the second day that we were able to report that we haven't made a new record in the past 2 days. Prior to that, we made new records the past 16 days, day on day. So it is nice to see that dip just a little bit. It's still a very high number, and it still is causing tremendous problems for hospitals and impacting the care that they're able to provide patients. Again, we have an unprecedented number. It's 58 hospitals have reached out to us for help. Many hospitals have canceled elective procedures. It's very challenging to accommodate transfers from a smaller hospital to a larger hospital that has the expertise that patients need. Those type of measures, while needed to ensure that the hospitals can care for patients, have real consequences and directly impact the care that patients receive. And this is not just COVID patients. So that remains true. That 2,999 number relative to our pandemic remains astronomical, almost 1,000 more than the peak, than the highest point prior to this fourth surge. So that remains a big point of concern for us. Go to the next slide, please. I want to speak a little bit about what we're seeing in the younger age groups, and I know Dr. Mukherjee will talk a little bit more in depth on this, but 18 through 29-year-olds, as you can see from the slide, remain the number one age group for new cases. And just short behind them is individuals below the age of 18. Over the past week, we have had 1,700 new cases in individuals between the ages of 0 and 4, and 5,700 new cases in individuals between the ages of 5 and 17. We're doing more testing in this age group, understandably, but we're even not testing as much as we probably need to. And the way we know that is that the percent positivities in those age groups are quite high, larger than the state's general population percent positivity, which, as I mentioned, was 15.5%. In the 0 to 4 age group, percent positivity of all tests conducted is 17.5. And in the 5 to 17-year-old age group, percent positivity is 28%. That's a marker of a lot of disease in these age groups. There were myths, misconceptions earlier on in the pandemic that kids don't get COVID, don't spread COVID. That couldn't be farther than the truth. Our kids are absolutely getting COVID. They're absolutely spreading COVID. There was an interesting study released in the medical journal JAMA this past week that showed young individuals in the household, when they do get infected, are highly effective vectors for the rest of the household, getting the rest of the household sick. And anyone that has young kids knows that, particularly around flu season, that kids can get you sick pretty easily. That's what we're seeing. It remains true that younger individuals are less likely to suffer the worst consequences of COVID. Not absolutely. And we have seen some very severe cases in kids. We've seen some very severe cases in very healthy kids, I should add. But that does remain true, but there's no doubt at all with the data we have right now that younger individuals, even as young as infants, are getting COVID and are spreading COVID, particularly to their families. We added this past week 10 new cases of multisystem inflammatory syndrome in children. This is a severe disease. This is a severe disease that has the likelihood for long-term complications. We now have had a total of 183 children with multisystem inflammatory syndrome throughout the course of the pandemic, and those, as I mentioned, can be quite severe cases. The next slide, please. We are thankfully not the number one state in the country anymore for new cases, but we're number 2, just behind Mississippi, and not behind by too much. I'll say I think there just remains a ton of COVID out there. And when you have this much COVID out there, it remains just as infectious as it always is or was. And it would not take very much for us to go back up to that number 1 spot. And that's a big concern of mine. Next slide, please. We haven't spoken about fatalities from COVID in a little while, so I wanted to present some recent stats. As every measure has gone up through this 4th surge, this surge response resulting from the spread of the Delta variant, we are also seeing fatalities go up. And I'll preface everything I'm going to say by, of all the measures we look at, deaths are the most lagging of those measures, meaning we often don't find out about deaths or find out in a formal, finalized, official manner until weeks or even a month or 2 after that individual died. These cases all get investigated. Coroners do a report, an investigation, and they get reported up to the Department of Health through that chain, and that often takes some time. So we often don't find out about deaths until weeks or even a month or 2 after that happened. Given that, to date in the month of August, understanding that August isn't over, and there are a lot of deaths that have already happened in August that we haven't received reports of yet. Given both of those things, we have received reports for 328% more deaths to date in August than in the entire month of June. If you look at individuals below the age of 40 during that same time period, fatalities from COVID have gone up by 1,467%. We reported today 67 new deaths Related to COVID, we reported 399 new deaths this week. We've reported 920 deaths to date in August, and that's a lagging measure. We're going to get many more reports for that time period in the weeks to come. All that to say, this fourth surge has been incredibly taxing and is causing real pain and suffering for families across Louisiana in ways that we won't even be able to formally quantify for a few more weeks. And when people consider what is needed or asked of people, I think those are points to remember. That there are real families suffering right now in ways that we can't even fully quantify. And with the limited data we have now, it's already apparent that this has been so devastating to families across Louisiana. I'd like to talk again about breakthrough cases. If you can go to the next slide, please. We, again, want to be as immediately transparent about these cases as we can, and we report them out every week. So amongst all cases, all new cases of COVID reported to us last week, 89% were in individuals who are not fully vaccinated. Of everyone who is hospitalized today, of the 2,999 people hospitalized right now with COVID, 91% are not fully vaccinated. And of all the new COVID deaths reported to us last week, 80% are in individuals that are not fully vaccinated. It remains true that these vaccines, the 3 vaccines we have available to us, provide excellent but not absolute protection. And when you're in the middle of a thunderstorm or a tropical storm or a hurricane, you need more than one modality of protection. You need a rain jacket, you need an umbrella, and if you can, you need to get the heck out of there. And that's what we need to do right now for Louisiana. There were some big announcements regarding additional doses and booster shots made this past week, and I want to go through briefly what they were to help families know what is available to them and recommended. We are now recommending a 3rd dose of Pfizer or Moderna to individuals who suffer from conditions that give them either moderate or severe immunosuppression. To be clear, this is a small group of Louisianans, probably between 3 and 5%. And we're talking about conditions like cancer patients receiving active chemotherapy, bone marrow, organ transplant recipients who are on drugs to suppress their immune system, patients who are on high-dose steroids or other drugs that suppress their immune system, or some very rare diseases that provide immunosuppression in patients. Relatively small subset of patients out there, but if that is you, and you received the Pfizer or the Moderna vaccine, it is now recommended that you get a 3rd dose of that vaccine at least 28 days after that 2nd dose. Can be longer than that, and for most people it will be longer, but at least 28 days. And the reason for this is when you have a weakened immune system, when you are immunosuppressed, you are less likely to mount a good response to a vaccine. Your immune system is hampered, and when you get the vaccine, you don't respond to it as robustly as someone who has a normal immune system does. And so you might need an extra dose of that vaccine to mount a decent immune response, to gain the protection that you should get from that vaccine. That's the rationale behind this recommendation. This is available in vaccine providers across the state. Any vaccine provider that stocks Moderna or Pfizer can and is offering this. We are asking patients to self-attest to these conditions, so there is no need to get your doctor to write you a note. If you have one of these conditions, you can go to a vaccine provider right now. If you're more than 28 days after your 2nd dose, self-attest to your condition and receive the 3rd dose, which is recommended by the Louisiana Department of Health and the CDC right now. Separate from that, 2 days ago, the White House announced their plans to likely make booster shots available for everyone who received a Pfizer or Moderna vaccine 8 months after they completed that series. I say likely because some things have to happen before that goes into effect. So it's not going to be for a couple weeks, 2 or 3 or 4 weeks until this happens. What will happen next is the FDA will consider if the data supports that, and will consider either amending the emergency use authorization of those two drugs, or we continue to await the full licensure of the Pfizer vaccine, which we think is going to happen very quickly. After that happens, then the CDC's Advisory Committee on Immunization Practices will meet to discuss in more granular detail the data behind that and make more specific recommendations. If and when those two things happen, we will then be in a position to recommend and make available booster shots for anyone that got Pfizer or Moderna 8 months after they completed that series. We have plenty of vaccine in Louisiana. We have a very large vaccine provider network. We have the machinery and apparatus in place to be able to do this. And we're just waiting on those two things to happen, the FDA to meet and approve this, and then the CDC's ACIP committee to make granular recommendations. Once those two things happen, and it looks like that will likely take place over the next few weeks, we will be ready to roll with those booster shots in Louisiana immediately. And the last thing I'll share is, we continue to have a lot of people choosing to start their vaccine series. We have seen a little bit of a dip in this past week from where we were before. We're now at between 10 and 12,000 Louisianans starting the vaccine series every day. That's down just a tick. But it still is an improvement from where we were a month ago. And I would, again, encourage everyone, just because you haven't chosen to get vaccinated yet, that doesn't mean you can't or shouldn't do it now. And when you look around and the number of people getting sick right now, the number of people landing in hospitals, there's every reason in the world to do it. Protect yourself and protect your family. And again, over 10,000 people made that very decision yesterday. So I would encourage people to think long and hard about what's valuable to them, what they care about, and how they can protect them. And most of the time, the answer is going to be about getting the vaccine to protect themselves and protect their family. I'll pause there. I'll be happy to answer any questions if there are any. Yes, ma'am.
What is the latest on booster shots for people who took the J&J shot?
No recommendation yet. There's data being looked at. The company itself is running trials in conjunction with the FDA, and that data is not ready yet. So I believe there probably will be a recommendation at some point in the future. It's just not available yet. J&J didn't come into circulation until March. So it does give a little bit of time, if we're talking about this 8-month time frame, before a recommendation would be needed, if it would be the same 8-month recommendation or not. So for people who receive the Johnson & Johnson vaccine, I understand the question. I think that's a legitimate concern. We're just holding out for a little bit more data to be able to make an informed decision on that. Mm-hmm. Yeah, Melinda.
Can you talk through the federal government's requirement that nursing home staff be vaccinated? When does that take effect? What does that look like for Louisiana?
It's still unclear. So what has happened with that is President Biden directed CMS, Centers for Medicaid and Medicaid Services, to craft emergency rules requiring vaccination amongst nursing home staff. CMS acknowledged that directive, have not yet issued the rule. Don't have a timeline on that. I imagine it would be relatively soon. He deliberately asked them to do it by emergency rule and not formal rulemaking process. So I would expect the timeline to be relatively short, but we can expect a detailed rule to come from CMS on what it entails, who it actually applies to. Presumably it would apply to any nursing home that accepts Medicaid or Medicare reimbursement, which is the overwhelming majority of nursing homes. Yeah. Clay?
Looking at the data, are you seeing any impact from the mask mandate yet?
Yeah, I think so. I like your haircut, by the way, Blake. I think so. Typically we look at this 2-week time frame after a mitigation measure is implemented to when you would like to see or expect to see some type of effect from that. The mask mandate's about 2 weeks or so since implementation, and we are seeing the beginning signs that perhaps we're plateauing or no longer seeing drastic increases. I don't, with the data I have on hand, I'm not comfortable yet calling that a trend because it's just really 2 or 3 days worth. So we'll pay very close attention over the next week. Hopefully it continues. Hopefully we can call it a trend at that point. Yeah. Great. Thank you. Well, it's a real honor and pleasure to ask Dr. Mukherjee to come up. She has firsthand experience with patients and families dealing with very difficult issues in this pandemic. So, Kim.
Good afternoon. Thank you, Governor Edwards, Dr. Cantor, for having me here today. I'm Dr. Kim Mukherjee. I'm a pediatrician in New Orleans, and I practice primary care pediatrics. And I'm hoping to bring a different perspective today that perhaps we haven't talked enough about, which is the impact on the daily lives of children in our state that so many of us in primary care have been seeing now for months and months on end. As Governor Edwards mentioned, I am also on our executive committee for the Louisiana chapter of the American Academy of Pediatrics. And so today I come here to speak on behalf of our nearly 750 members, on behalf of my pediatric colleagues from the state, but also, and most importantly, on behalf of children from Louisiana. There is no question that children have carried the heaviest weights of this pandemic in so many ways. Every impact we have talked about, from economic to health to education, all the different ways this pandemic has impacted families in our state, there's a child on the other side of that that has taken a direct harm in many cases. These are children who have lost caregivers, parents, grandparents. These are children whose year plus of education has been disrupted. These are children who have given up social activities and other activities that are so vital to the development and social well-being of children now for over a year. These are the children I've been seeing in my clinic and so many of my colleagues have been seeing. And while for the past many weeks we've been hearing from many hospital leaders from around our state, including our pediatric hospital leaders, we have to remember that these outcomes of a child ending up in a hospital is the exact outcome we hope to prevent. And there have been many, many healthcare providers on the other side in the community trying so very hard to prevent that exact outcome. So I come here today to speak to you as a pediatrician. I want to talk to the parents who are scared, the parents who are worried. We hear you. It is our absolute honor and privilege as pediatricians to be with you as you navigate difficult challenges and decisions with your child's health from day one. It's our honor to be there in the hospital when your children are born, to navigate those sleepless nights early on, to send your 5-year-old off to kindergarten with all of their vaccines. This is what we do. It is our job as pediatricians to ensure that children are safe, that their well-being is taken care of, and that we work with their parent and caregiver to maximize that child's potential, to thrive. That is our goal, that these children thrive. When we have a pediatric death in our hospitals, when we have children admitted for a preventable illness, we've failed our children. But it's more than that. When our children are falling behind in their education, when our toddlers are unable to reach their developmental milestones and are falling behind, in fact, because they can't access really key early interventions, we've failed. When we can't provide food and nutrition and medication for our children, we have to ask ourselves, what can we do better? How can we ensure that these children are safe? As your child's pediatricians, we will tell you that there are many things you do day in and day out to keep your child safe. From buckling up your baby and toddler in a car seat, to putting on a bike helmet when your child goes off for a bike ride. These are tools that keep your child safe. It is our honor to help you navigate these discussions of how to best keep your child safe. And now we have new tools at our hand. We have masks, we have vaccines, and we must look at these as essential tools in our toolkit to keep our children safe. This week, our Academy chapter of American Academy of Pediatrics here in Louisiana sent a letter to Governor Edwards and his team supporting the mask mandate for children in schools. We know that children thrive when they are in school, and we must prioritize that they have this opportunity to be in school, to learn, to grow, to develop, to maximize their social skills, their educational achievements. But we have to ensure their safety. And one of the most important ways we do this is through universal masking in our schools. It's a multi-layered approach. Masks are an important prong. We have vaccines, social distancing, good hand washing. All of these factors must be incorporated. But now is not the time to be asking, what should we take away from our children? Now is the time to be asking, how can we keep them safe? And I urge every adult, every parent, everyone who has loved a child, knows a child, every single person in our state to center this conversation around the safety of children. When a child is safe, they remain healthy. When a child is safe, their well-being is maximized. And all of our discussions must center around how to keep children safe. Now is not the time to politicize things that we know are excellent measures to mitigate the impact of a preventable illness on children. Our Louisiana chapter of the American Academy of Pediatrics stands firmly with the American Academy of Pediatrics that children must be in school and kept safe to prioritize in-person learning. One death is too many. One child who falls behind is too many. Another parent coming to my clinic who has run out of formula for their baby is not acceptable. Another adolescent coming to my clinic with a mental health crisis is not acceptable. We have to do better by our children. And we do this by centering their safety and their well-being at the middle of every discussion we have. And so as a pediatrician, I remind you that we are here for you. We are here to have these discussions. We understand you may have questions. That's okay. Just like every other decision you have had to make for the health of your child, we want to navigate these questions with you. We want your 12 and above adolescents vaccinated, and we want to start having conversations with you to answer your questions about your younger children so that we are ready to vaccinate our 5 to 11-year-olds when that vaccine is available. I urge you to remove the politics, to remove the arguments from this discussion, because no one in this room or in this community or in this state would argue that the life of a child should be anything other than prioritized and that that child should be safe and thrive in their childhood. And we as pediatricians are here to help ensure that that happens. Thank you very much. Happy to answer any questions. Yes.
Thanks for being here, Doctor. Can you talk a bit about when it comes to how the virus is impacting children, sort of what is known and what is unknown at this point about, is it more, is it that more children are getting it because, there's more interactions? Is it more virulent in children? Can you talk about how it's impacting children?
Sure. So what we know right now is that we are dealing with a completely different animal than what we saw last year. This Delta variant is highly transmissible in kids. We know kids are getting sick. We are seeing a high positivity rate in our clinics. This is unprecedented numbers of children in our hospital system sick with COVID, including in the ICU. And so what we know about COVID is that it absolutely impacts children and that we are seeing higher rates of it currently than we have ever seen before. We also know from a year now plus into this pandemic that the impact of COVID on children is much more than the disease burden itself. And therefore, we have a really large responsibility here to really mitigate that disease burden so we can also mitigate the impact that COVID has on children in all of these other factors. Thank you.
Thank you, Dr. Mukherjee, and thank you, Dr. Kenner. In closing, I just want to remind everyone that you can always call 211 to find the vaccine location nearest you. You can also visit covidvaccine.la.gov to get more information. And if you care to speak with a medical professional, you want help scheduling an appointment, you can also call the Louisiana Vaccine Hotline at 1-855-453-0774. The next press conference will be next week. I'm not exactly sure yet when that's going to be. We've got a number of things going on, and so we will announce that later. And right now, I will take some questions if you have them. Yes, ma'am.
So you've talked at length of the importance of having masks in schools, and there's been 2 public meetings this week that have dissolved over this topic. What would you say to parents who say it is their right to decide if their child should be wearing a mask at school?
Well, I would remind them that we have a public health emergency, and that emergency exists because we have a virus that is highly contagious and deadly. And we all have a responsibility to minimize transmission, to minimize cases, hospitalizations, and deaths. And quite simply put, there is no right to unreasonably endanger the lives of others. That doesn't exist. And rights under the Constitution are not absolute. They're subject to restrictions as necessary, and certainly in a public health emergency, restrictions are necessary. We have to minimize the spread of this disease, and it is spread primarily through respiratory droplets. That is why masking works. It captures droplets from an individual to keep them from spreading to others. It also protects the wearer from droplets that may be emitted by others. And we know the work. The science is very, very clear around masking. That's why it's a CDC recommendation. That's why it's an American Academy of Pediatrics recommendation. And it's not something that we have to guess about, because we've done this in Louisiana and elsewhere around the country and around the world for quite a while now. And so I would just ask parents to take a look at the current situation that we have. I had every expectation a couple of 3 months ago of not having a mask mandate in place when school started. I was going to leave that up to school districts, but the facts changed. We went from having about 275 people in our hospitals to now 3,000. Have the highest case growth rate in the country for all of those weeks, and now we're number 2, which I guess is some relief. But if you look at that number, nobody should feel really better about that. And so we have to keep our children safe. You cannot keep schools open and children safe today without masks. And if you look elsewhere around the country, particularly the South, where you have high disease burden, not as high as Louisiana probably, because we've been the highest, and see what's happened when schools go in without mask mandates, you see that quite often they're having to close schools up, send kids home for 10 days or 2 weeks, and when they come back, they're coming back with masks on, right? And so it's just for all of those reasons, and for many, many more, it's very, very important that we have kids masked. And, you know, kids are suffering directly from COVID, and they're suffering indirectly, and I think Dr. Mukherjee did a great job of detailing that. And there are kids in the hospital with the classic respiratory problems related to COVID and the multi-system inflammatory syndrome. We've got kids under 2 in ICUs on ventilators. But even if kids themselves weren't suffering ill effects, and they are, in fact, they are in greater numbers than we've ever seen up to now in this pandemic, they are still a very considerable source of spread. And we have to get the transmission down as a whole across the state of Louisiana, and putting masks on kids is really important. It would be an absolute recipe for disaster to take kids from all across the state of Louisiana, put them together for 7 hours a day in close proximity to one another, indoors, unmasked, and then send them back in the community at the end of the day. That is exactly what you don't do in a public health emergency like we currently have. You know, we sent UH-60 and a crew, it's a helicopter, National Guard, to California last week in order to engage in fighting forest fires. And the equivalent would be to sending kids to school right now without a mask would be to have that UH-60, rather than dumping water on the fire, dump diesel. That's the sort of equivalent we have here. So I would encourage parents to take another fresh look at this, and because quite frankly, the things that I've heard, the things that I've seen that come out of the ones who are most animated, at least, they just don't make sense. They're not in our children's best interest. Those actions would not be in the state's best interest. And quite frankly, we should be better than that in terms of being good neighbors to one another and giving a break to all these healthcare workers who've been working so hard now for a year and a half. Yes, ma'am.
Governor, on that same subject, I know we've talked about this several times about enforcement, but are you actually comfortable that the mask mandate is being enforced in these school districts? I mean, obviously, we were at a Bessie meeting where it wasn't even being enforced in a state building that had state police officers in it.
Yeah. The report that I've received this morning in my weekly update from the state epidemiologist, and what I've gathered is that the vast majority of schools are effectively implementing this mask mandate. And quite frankly, we're gratified by that. And if there are schools out there that are not doing that, I would encourage them to get with the program and to do it immediately, because they're not going to stay open. The kids are not going to be safe if they don't do that. I mean, you heard me give the numbers earlier today about what's just been reported in the last couple of weeks about cases among staff and students in our schools and the number of close contacts that have been identified. This is very real, and we can learn from what's happening in other states. So in Mississippi, you may have seen that the Pearl River County school system had to close down, and for some period of time. And when they come back, they're going to come back with masks. Well, that's right across the river, right from St. Tammany Parish. And as far as we know, the disease burden in Pearl River County is lower than it was in St. Tammany, at least back when school started. So we just need to, I think, be more reasonable, more responsible, and set good examples and be good neighbors. And all of that. The science is so clearly and emphatically on the side of masking, especially in schools. When you know that nobody under 12 has received the vaccine, when you know that those between 12 and 17 have been vaccinated at a very low rate, it's critically important that we mask. Any other questions? Yes, ma'am.
I'm wondering if you have any reaction to what happened at the Bond Commission meeting yesterday and the withholding of the approval for all of those New Orleans projects. Have you been filled in on what the reasoning was there, and what's your response?
No, but there's not a good reason, and I suspect all those projects will be approved soon. Look, thank you very much. We are no doubt in a very difficult place. I am gratified that for the first time in a long time we could come in here and tell you that our percent positivity has decreased very slightly. That for the last couple of days, the number of people in hospitals have decreased very slightly. That we are no longer leading the nation in terms of our growth rate in cases over the previous 7 days relative to population. But I also know that this is just a couple of 3 days. It's not yet a trend, and that the disease burden in this state, in every single community of this state, the number of COVID inpatients in every region of our state is unacceptably high. And just look at it historically, and maybe not over the last 3 or 4 days if you go back then, but go back to the previous surges. We're still a third higher than we were previously. So we've got a lot of work to do. And I especially want to thank those Louisianans who are doing what's being asked of you, who understand that we all have a role to play, that we're all responsible for reducing transmission in cases and hospitalizations and deaths. And that you are trying very hard to be a good neighbor. And we've got a long ways to go. And it appears to me that we're going to all have to make two adjustments in order to live with COVID for some extended period of time. And those who refuse to make the adjustments might just die with COVID and cause other people to die because of COVID. It really is that simple. So let's all do the best we can. Let's pray for one another. Let's lift one another up. And Dr. Cantor says this all the time, and I kind of want to close here today. It doesn't matter what reasons people have given to others or to themselves up to now for not being vaccinated. Today is a new day. Tomorrow is a new day. It is not too late to do the right thing, the smart thing, for yourself, for your family, for your community, for this state, for the healthcare workers. Please go out and be vaccinated. And because we know that we can't vaccinate our way out of the immediate problems related to this surge, I'm calling on you to also wear the mask. It is a very small price to pay. It is not an onerous burden to wear a mask indoors when you cannot socially distance from others. Thank you.